Written assignment number 3 by me. The thesis I chose is called Efficacy of an Internet-Based Learning Module and Small Group Debriefing on Trainees' Attitudes and Communication Skills Toward Patients with Substance Use Disorders, Results of a Cluster Randomized Control Trial. The thesis mainly speaks about how an Internet-based learning module, which seems to be something like PowerPoint or maybe Zoom, alongside small group debriefings can help boost the attitudes and communication skills of trainees toward patients that have a drug abuse problem. Learning how to use different platforms or ways of teaching can overall benefit the functionality of the workplace or any place this is used. It could be school or at home if you want, and create a better environment for everyone, customers and workers alike. Again, anyone. The purpose of this thesis is to examine whether an Internet-based learning module and small group debriefing can improve medical trainees' attitudes and communication skills toward patients with substance use disorders, or SUDS, which is basically drug abuse. To summarize, the purpose of this thesis is to test whether Internet-based learning and small group debriefing can help to improve attitudes and communication skills of medical trainees with patients who have drug abuse issues. This is important because learning how to deal with people who may act out whenever they feel like it can help you understand the reason for their acting out, and also how to stay safe if they choose to attack physically. Understanding which ways of teaching are most effective will most definitely allow healthcare workers and practically anyone who works with patients and that have disabilities, drug addiction or mental problems, again with wherever this can be used, at home or whatever. In conclusion, the thesis main purpose is to examine whether an Internet-based learning and small group debriefing can improve medical trainees' attitudes and communication skills toward patients with substance use disorders. The way this thesis was put into testing was This thesis was put into testing in 2011 to 2012. No, wait, my bad. The way this thesis was put into testing was in 2011 to 2012. The people who tested this, their name or names aren't stated, brought 129 internal and family medicine residents and 370 medical students at 2 different medical schools to participate in a randomized controlled trial. This trial would assess the effect of adding a 2-part intervention to the SUDS curricula. The intervention included a self-directed, media-rich Internet-based learning module and a small group faculty-led debriefing. Primary study outcomes were changes in self-assessed attitudes in the intervention group dubbed I group, and were compared with those in the control group dubbed C group. For residents, the authors used real-time web-based interviews of standardized patients to assess changes in communication skills. Statistical analyses, which were solely conducted for residents and students, included hierarchical linear modeling, adjusted for site, participant type, cluster, and individual scores at baseline. In conclusion, the thesis' method was to bring many subjects and test their hypothesis. The result of this project was very strange. The authors found no significant differences between the I and C groups in attitudes for residents or students at baseline. When compared with those in the C group, residents but not students in the I group had more positive attitudes towards treatment efficacy and self-efficacy. Likewise, compared with residents in the C group, residents in the I group received higher scores on screening and counseling skills during the standardized patient interview. In conclusion, the results showed little difference between the I and C groups, with both groups having positive results. In conclusion, this intervention produced improved attitudes and communication skills towards patients with SUDS among residents. Enhanced attitudes and skills may result in improved care for these patients. Thank you.